Ladies and gentlemen, for the series of cardiovascular principles and anatomy and physiology, we end by looking at blood flow and blood pressure and how there is control in how this takes place because it is crucial for maintenance of life. So blood flow um, is related to the arteriolar function and just the vascular system itself. So we are talking about issues of vascular resistance. We are talking about issues of it related to changes in pressure and also related to resistance. That basically blood flow is a measure of how much blood is passing a particular point. And the flow, because this is fluid, is directly related to the change in pressure. So flow will be determined by the difference in pressure from point A to point B. So for the flow of blood to take place, there has to be a region where there is a higher pressure and a region where there is low pressure. So the heart plays this role in creating a higher pressure zone from the heart side of things and to the tissues where there is a lower pressure zone. So that ensures blood flow in that direction. Resistance, in this case, is the impediment, the opposition to the flow of blood, such that if the blood vessel is narrower, the resistance is higher. If the blood vessel is wider, then the resistance is lower. So vasodilatation ensures less resistance and vasoconstriction ensures a higher resistance. Yeah. So just to put things into perspective, Professor Ohm actually explains this in relation to what he characterized in the discussion of the relationship between current, electromotive force, and resistance. That the amount of charge that flow, okay, which is in this case blood flow, if we want to relate, the amount of charge that flow, which is the current, is related to the difference in potential, is related to the potential difference between one point and the other. If the potential difference is larger, then the current that will be able to flow, the amount of charge that will flow from one region to the next will be higher. But again, this current, the amount of charge that will flow, will be less if the resistance is high and will be much larger if the resistance will be low. So this was Ohm's law, and this when it is applied to blood flow, it relates to the fact that blood flow now will be related to current, and the electromotive force that ensures that there is potential difference will be the change in pressure, and the resistance in this case will still be the resistance to the blood flow. So in this case, we are saying flow in any portion of the vascular system is equal or direct proportional to the effective perfusion pressure. Okay, if the pressure difference is very low, then flow will be very low. So if the heart is failing to pump, then the flow of blood will be less and will go into what is called shock. The effective perfusion pressure is the difference between a pressure in the arteries and pressure in the veins, because the arteries will deliver blood from the heart and the veins will deliver blood away from the heart. Resistance is described by a relationship that compares resistance to viscosity, resistance to the length of the tube, and also resistance to the radius of the tube. So it says that if the resistance, if the viscosity of the blood increases, maybe there's a tumor that is producing a lot of red blood cells in the bone marrow, there's a cancer that is producing a lot of white blood cells, the thickness of the blood becomes higher, the viscosity becomes higher, and the resistance will be very high. This can lead to hypertension and things like that. the length of the tube, the longer the length of the tube, the higher the resistance. So for example, if we have a tube here pumping water or carrying water, and we are taking this water to a very distant site, for maybe we say Ballaston to Great East, the resistance will be higher compared to if we are moving just this water from one house to the next. So, but then the goodness is that the length of the blood vessels in the body are almost constant when you have matured, and the viscosity will be maintained at a relatively constant. So then now the only issue is the patency or the radius of the blood vessels. Remember, a portion of the blood vessels like the venules and the arterioles, they have smooth muscles that are able to contract and relax. Therefore, they are able to change the radius of the blood vessels. Therefore, they can affect resistance. In fact, for every change in resistance, radius, there will be 16 times increase in the resistance of blood flow, because the resistance is inverse proportion to radius to the power 4. So blood pressure can be measured by auscultation, where we use the stethoscope to listen to what are called Korotkov's sounds. But I think modern technologies have allowed digital devices to be able to measure blood pressure without any problems. The normal blood pressure is around 120 systolic versus 70 diastolic. So when the heart is pumping, the systemic circulation is expected to be at 180, and in diastolic phase, the diastolic pressure should be around 70. What would be the determinants of blood pressure is the amount of blood that is pumped per minute, which is cardiac output, and the resistance. Therefore, blood pressure is direct proportional to cardiac output and peripheral resistance. But how is this blood pressure controlled? In the short term, it is through the baroreceptor reflex. This is achieved by pressure receptors found in the aortic arch and bifurcation or the branches of the carotids. The aortic sinuses, which are the mechanoreceptors responding to stretches as a result of pressure of the blood, and also the carotid sinuses. You notice there's a difference between aortic bodies and aortic sinuses. The aortic and the carotid sinuses are pressure sensors. The aortic bodies and carotid bodies are chemoreceptors for oxygen and carbon dioxide detection. These receptors are connected to the cranial nerve number 9 and 10, which are glossopharyngeal and vagus respectively. These, they receive impulses as a result of the stretch, and they direct these impulses to the heart, such that if there is a high stretch, it means the heart is pumping more. They will inhibit heart function, and that will reduce cardiac output. Then this will produce a moment-to-moment blood control. For long-term control of blood pressure, it is the renin-angiotensin-aldosterone system, which ensures that there's production of angiotensin II after poor perfusion of the kidneys. And this will lead to vasoconstriction, increased thirst, and increased aldosterone activity. This will lead to restoration of blood pressure back up. Thank you very much.